So someone posted in the comments to another one of my videos that is it okay to take probiotics along with the rifaximin for SIBO treatment? And I would definitely say no, because with the rifaximin, the idea is that you kill off the overgrowth of bacteria in the small intestine, and it does go in the large intestine. That's another subject matter altogether. But we really don't want to be re-inoculating that area with more bacteria, which is what would happen if you took probiotics. Now, probiotics are useful in a fungal overgrowth situation to help compete against that situation. But if we're treating SIBO, I generally avoid probiotics and I go more towards prebiotics and polyphenols from fruits and veggies to help regrow. And sometimes you can do postbiotics, which is a whole other subject matter. I can talk on another reel. But postbiotics are basically sterilized stool. And yes, you can get that. And yes, it does help re-inoculate and regrow the colony. It's kind of like a fecal transplant without using actual live stool. So that is an option available, but that's a whole other subject matter. But I would not take probiotics while you're trying to treat SIBO with antibiotics. And further on that subject line, I wouldn't choose antibiotics as my first line treatment, because we've seen there's a lot of recurrence. We've seen kind of mediocre results or temporary improvement, but it doesn't really address the problem. And then, of course, you have to go into the root cause of the SIBO. What is stopping the motility? Is it just the methane produced by the methanogen overgrowth that can slow motility? It could be from a history of food poisoning. It can be also from a history of abdominal surgery. So there's a lot of other things that could be the root cause for this issue. Gastroparesis from GLP-1s. Seen that a lot lately, sadly, because GLP-1s can work magic on people who have trouble with their metabolic health. But anyway, the original question, probiotics during SIBO treatment, I would say no. Okay. Let me know if you have any further questions. Happy to answer them here.